on the dot. So I'm going to go ahead and kick things off with our webinar today on staff care assessments. So I'm going to start briefly with some introductions. And first of all, thank you everyone for joining us today to learn more about KonTerra's staff care assessments. I'm Kate Allen, the Director of Account Management of the Resilience Practice at the KonTerra Group. Our goal is that you leave here today to understand how we can help you be more effective via our staff care assessment service. This session will be recorded and will be saved on our website in our resource library for future viewing. We will send out a notice via social media once it's ready. We will also have time for Q&A discussion at the end of the session. You will be able to submit questions to us via the Q&A function within Zoom. Next, I'll hand it over to Lisa for a brief introduction.
Hi, everybody. Thank you for making time in your schedule today to be with us live. And for those of you who are watching this recording later, we really appreciate it. I am Lisa McKay, the KonTerra Group's Senior Training Advisor. My background and training is in forensic psychology, and I have worked to support INGOs in various countries around the world for the past 2 decades. The KonTerra Group has conducted more than half a dozen of these in-depth staff care assessments in recent years, and I've participated on many of those teams. And one of the things that really excites me about staff care assessments is that the chance to sort of do an in-depth look at what's at play for a specific organization, where their pressures and stresses are, what's going on for their staff, and to think about how they can carry a focus and a passion and create space for giving attention to staff well-being more systematically as they move forward. So I'm super excited to be here with my colleagues to discuss this really important topic today. And I'll hand it over to Mike to introduce himself.
Hi, everyone. Thanks for joining. So I'm Michael Wolf, and I am a part of the organizational resilience roster for the KonTerra Group. And I've spent most of my career as a frontline worker in various international development and humanitarian organizations, working in high challenge environments, working in active war zones and post-conflict contexts, and then also following natural disasters, complex humanitarian emergencies. So I come from the angle of being a field practitioner in some of these high challenge environments. I'm very familiar with the types of challenges that organizations face when they're seeking to do this type of work, and also look after the well-being of their staff so they can continue to do the work that they want to be doing. I've also trained as a professional coach, and so I bring that into when I serve for organizational resilience projects as well.
Great. Thank you so much, Mike and Lisa. So let's go ahead and jump right into our discussion questions for today. So if we can, let's start with a brief overview of the case study that we'll be talking about today. Lisa, can you provide some background information about the organization?
Sure. So the organization that we're discussing today as a case study anonymously is a large nonprofit who works to support and advocate for refugees, and they have offices and staff in multiple countries around the world.
Okay, got it. Thank you, Lisa. What were the main challenges this organization was facing, and how did you approach these challenges?
So the organization was aware that their staff served some of the most vulnerable people in the world in some of the most challenging and complex environments. And they were also aware that this sort of work was taking a toll on their staff. And they partnered with KonTerra because they really wanted to take a deep dive into assessing the current needs of their staff and the current state of well-being. So sort of taking a look at the lay of the land to see where we were before they made decisions about what they could and did want to do moving forward. So they wanted us to take a look at what was at play, including the risks, the issues, the resources, and the gaps as it related to staff wellbeing. They wanted the assessment team to help them by identifying specific needs and initiatives tailored to staff in different countries. And they and we recognize that needs and resources can vary across regions and projects. And they wanted the assessment team to come alongside them and really help them to develop a staff wellbeing or a duty of care framework and plan that would guide action taking throughout the next several years.
That's great. Thank you, Lisa. So then where did you all start?
Well, the first part was being able to meet with members of the leadership team and other key stakeholders to really define the scope of what we were doing, talk about the proposed approach, and also be able to make sure that there were clear understandings as to, and get input from leadership, and then clarify understandings so that we could move forward together well.
Great. Thanks, Mike. And where did you go from there? How did you get the information that you needed to help the organization assess staff well-being and identify specific needs?
So in those initial consultations with leadership, we spent a lot of time talking about how are we going to get a clear picture of what's going on, because, you know, it doesn't always feel safe for staff to share honestly what they're experiencing within an organizational context, especially if they're concerned that information or what they say might end up filtering back in ways that's identifying. So we talked with leadership when we were talking with the executive leadership and with the advisory committee that we recommended that they form to come alongside us to help guide the project and make sure that we stayed aligned on expectations and process. We talked about data analysis, gathering data via several channels. So we wanted to have a look at what was currently written down, so what their policies and processes were, and I'll talk a bit more about that in a minute. We wanted to have the chance to hear in depth from a number of their people. So we conducted a number of interviews and focus groups. And we also designed and distributed an all-staff electronic survey. So that was 4 of the ways we tapped into the data. And the policies and processes, I'll just start with there. And I think Mike will be talking about interviews and focus groups in a little more detail. But the reason we take a look at what is written down is it gives us an idea of what's already in documents like the employee handbook, which documents all the leave policies and the processes for how we approach that. Any documents related to duty of care, documents related to the mission, vision, and values of the organization, because the values come into play in terms of when we're designing duty of care frameworks and plans moving forward. Those values can be enormously powerful in helping us shape sort of a direction of where we want to go and providing signposts and anchors for that. And also any documents, for example, related to what the organization does and how they operate when emergencies or critical incidents happen that involve staff. So those are some of the documents that we want to take a look at when we're looking through a policy and process lens early in the assessment process. And Mike, you want to share with us about what we were looking for and how we conducted the interviews and the focus groups?
Yeah, sure. So we conducted several dozen individual interviews of staff from across the organization, different geographic locations, different levels within the organization, you know, regional office staff and country office staff and headquarters staff, and different functions, right? And these individual interviews were held extremely confidential, and it enabled people to give their input from their vantage point, from their perspective, about what stressors they were facing, what things the organization was doing to assist them with their well-being, and also some things that maybe weren't working as well as what the organization might have intended them to be working, right? Most of those interviews were conducted in English. However, a number of them were conducted in languages other than English. We also did about half a dozen focus groups, and these enabled us to get a cross-section of individuals across the organization. And largely, these enabled us to get even closer down to country level. And most of the focus groups did come at country level, and most of the focus groups were conducted in languages other than English. And again, this enabled us to talk to a group of people that had similar functions to see if we could see similar themes emerging from similar functions, maybe across differing geographical locations. But this could give a really good input as to what was happening for a set or a group of staff members across an organization.
Yeah. And then with regards to the all staff survey, the electronic survey we designed, we asked about things related to staff perceptions of managers and leaderships, and we asked about staff perceptions related to the extent to which they felt the organization was meeting some standards related to duty of care and staff wellbeing support. And we asked about a lot of things related to sources of pressure related to their work, their perceptions of leave, when and how they could take their leave and whether they were taking their leave, some basic markers like that. They gave us some really interesting information. And in this particular organization, more than half, about half of all staff in the entire organization completed that survey. So collectively, the survey, the interviews, the focus groups, the policy process review, the discussions with leadership and working closely with an advisory committee gave us a really rich set of data and a really robust foundation for thinking through what was at play for this particular organization and then making the recommendations that the assessment team went on to make.
That's fascinating. It's such a thorough, multifaceted approach. So I'm really curious, after you went through these different steps, what did you find?
Lots of things. And you're quite right. Like, it was good being able to have lots of different types of data, because that enabled us to triangulate, that enabled us to verify and make sure that we weren't just relying upon one source of data or one voice in one little corner, right? So look, I mean, there were lots of things that came out. I think one thing that came out, excuse me, very clearly, especially as we were doing the interviews in the focus groups, but even in the all staff survey, people were passionate about the mission of the organization. People were really dedicated. A lot of people really believed in what the organization was doing and were proud to be part of what the organization was doing, and really were giving themselves and their energy to it. And it was quite inspiring to see that and to be part of that. It was clear that the organization cared about well-being. They were aware of that as something that was important. They were doing different things to try to support that. I think another thing that became very clear to us through the process is, I guess if I were to bottom line this, I would say the amount of complexity that the organization has experienced across all corners, and complexity in lots of different dimensions, has increased dramatically in recent years. And increases to complexity in programming and in operations frequently lead to challenges in staff well-being. Okay, increased complexity frequently leads to decreases in well-being is kind of a bottom line statement. And we were able to see that manifesting in lots of different ways in different dimensions. Okay, so there was, this was happening during and after the initial stages of the COVID-19 pandemic. That's, a big one. And also is following a period where the organization had experienced quite a bit of growth. And growth maybe in new geographical locations, so expanding to new countries, or expanding to new geographical locations within existing countries where they were operating, or I should say, and/or new programmatic areas. So expanding their programming into new areas where they hadn't, new sectors where they previously had not done programming. And so when you can imagine these multiple dimensions of expansion and multiple dimensions of increased complexity, and how that impacted the staff was again multi-dimensional and quite profound.
I think another thing that we found was that the lion's share of staff wellbeing issues for this particular organization were not isolated to staff members' routine exposure to suffering. So pressures related to workload emerged really strongly from the survey data, and even more strongly from the interviews and the focus groups, as the single most significant contributor to staff wellbeing challenges and staff stress. And in fact, one of the things that we ended up sharing with the organization was that if they didn't figure out how to engineer authentic change in relation to staff workload, then many of the other things that they attempted to do or chose to do to support staff well-being were going to be of limited value. And that said, the root causes of these workload pressures and the well-being challenges for staff in this situation were complex and involved multiple contributing factors. So some of the most important root causes of well-being challenges in this case that we identified included an organizational culture of perpetual urgency that promoted overworking. That was being modeled at and contributed to at all levels. Vicarious trauma due to the nature of the work that was just inherent in the nature of the refugee-focused work that these staff were doing. Recent rapid growth, as Mike has mentioned, and the attendant complexity that comes with that. The uneven capabilities of managers in different locations and different offices. Inadequate staffing in some teams and locations. And you know, I'm not naming new and novel pressures. There's going to be many people listening to us talk about this who will be able to identify some of these same ones at play in their organization likely. But the coalescing of these pressures give you a better picture of what's happening for this particular organization. There were some gaps in foundational policies and processes that guided decision-making in particular, and that was contributing to complexity and delays in certain specific ways that were impacting staff well-being, and the same in relation to communication. So we identified and discussed certain operating processes and patterns related to communication, authority, and decision-making at different levels, and particularly between country offices and regional offices and headquarters. So those are a couple of that's not an exhaustive list of what we discussed and identified, but those were some of the most important root causes of wellbeing challenges that we explored in this particular case.
And just to add on that, like, yes, there were so many things coming into that system. Yeah, Lisa, I was under the impression that leadership was cognizant that some of these challenges to well-being were impacting the organization's ability to perform as effectively as they may have performed in the past. They were aware. They weren't in no way blind to this. However, because it's such a complicated system of so many different factors and facets, they were a bit like, okay, well, where should we focus prioritizing energy? Where should we start first on this? And you know, I think as we were able to, you know, analyze the data and go through this process, we were able to kind of look at these different factors, these different parts of the constellation, and then be able to come up with some specific recommendations around each of those contributors and around things that the organization could choose to do that could help to move the needle on staff well-being that would then lead to increased organizational effectiveness and being able to achieve what they wanted to be able to achieve.
Absolutely. Like the news that workload was a problem didn't come as a shocking newsflash to anyone in the organization, no. As it does to, I think, it doesn't to anyone in this field. But taking the opportunity to pause and look at the data, the whole array of the data, and think and the impact of that, and to take time to acknowledge the impact of keeping going the way we've been going, and where does that lead us, and what does that look like, and can we craft a different culture, a different future with regards to staff well-being, even in the midst of very significant industry-related pressures and organizational pressures that are at play within this context. So yeah, I think you're absolutely right, Mike. The leadership, a lot of this didn't come as a total surprise, but the opportunity to see it in depth and to really take time to think it through is crucial for then informing what do we do, where do we start, what are those strategic points of influence that if we throw energy in that direction, give us a chance of actually moving the needle when it comes to staff well-being.
And I think there were some components that were maybe more surprising, or that they weren't able to see because of their vantage point, right? Like nobody sees the water they're swimming in, right? So Lisa talked a little bit about how there was part of the organizational culture was a culture of urgency, and you know, we have to do this, and I think, you know, there was also a bit of a culture of self-sacrifice and you know, kind of glorifying self-sacrifice because, we have this mission to serve the beneficiaries. And so like those are notable, those are honorable, notable, laudable things. And there's a way in which if that's the water you're swimming in all the time, then you don't necessarily see another possibility, or you don't necessarily see how that impacts people across the organization. So I think this survey, this assessment also enabled leadership to see some of the ways that their actions were contributing to a whole soup of contributors that led to decreases in well-being, which then also led to decreases in operational effectiveness.
So that kind of leads me to, where I'm going next, Mike, is thinking about, I mean, that is quite a list for this
Yeah.
organization to, look at. But like we said, it's also relatable. These to me
Yes.
sound like common, challenges that organizations face. But I would like to hear more about one or two of these factors and how they influence staff well-being.
Sure. Sure. No, and you're spot on. Like these types of stressors, these types of things are not unique to this one organization, and they're not entirely unique to international NGOs either. I do a bunch of coaching of leaders in for-profit companies, and I see these sorts of tensions coming out all over the place. So I just want to normalize that and say, like, these sorts of tensions are not unique to this one case study. I think they're quite universally applicable. Now, you asked, like, what were some of the things that we saw coming out, right? Like, what were some of the factors? A big one was, just how all the growth, all the complexity, and all the changes that had happened and the increases of complexity did have impacts on the staff, and particularly on managers, right? And so, I mean, one of the things that Lisa mentioned, we talked about the uneven capability of managers. I think another way I like to look at this is saying, like, the current capabilities of managers may be lagging from what the organizational system is currently demanding. Okay, it's more of a systems thing. And so, okay, if managers are currently lagging beyond what the system requires, what are the impacts? What does that end up doing? And what that can end up doing is, like, you have people that are underneath that manager that maybe aren't receiving the attention, the care, the support that would help them to best thrive and do their jobs, and support their well-being. So you can have, sufferings of well-being for people below a manager because the manager maybe isn't able to manage for well-being as well as she or he may otherwise be able to, right? You also have impacts for people who are above that manager, because people who are above that, if you have a manager whose current capabilities are lagging behind what the system demands, then somebody has to fill that gap, right? And it's oftentimes the manager or managers above she or he that have to, backfill, step in, put out fires, all those sorts of things. And then, once someone at this level has to spend 50% of their time, and we found this in some of the focus groups and some of the individual surveys, we found people saying, I spend 50% of my time firefighting and backfilling, and then I can't do my job, right? And you can just imagine what then that leads to, right? So you have that dynamic, right? You also have the dynamic of horizontal or diagonal. So often with international organizations, I mean, with any organization, you have like support service team. If you have a manager whose capabilities are lagging, that might have impacts on a support service team who's trying to provide financial reports or something like that. And delays here lead to delays here and lead to more stresses here. And so you just see ways in which the increasing complexity across many dimensions has impacts on managers, and the current competencies of many of the managers were lagging behind what the organizational system was demanding. And then that had reverberations across the entire system, across humans, across that entire system. That was a big one.
Yeah. Yeah, it's really interesting, and it just, of course makes me think, like, I'm glad that an organization like KonTerra exists to be able to provide support to address that, right? Because
Yeah.
it's hard, right? When that's what you first know, like, you recognize that there's this problem and that it has such a long ripple effect that you just described. I know that could probably feel a bit overwhelming, but we're going to get to that a little bit more in our discussion. So I'm thinking, I know KonTerra has conducted quite a number of these staff care assessments for different organizations. How common are these sorts of findings?
Look, the majority of the findings that we've talked about and that applied to this organization they're not unusual. As Mike said, there are a lot of common pressures at play within this industry in how the funding operates, in what the project cycles do to the sense of urgency, to help create and feed into that perpetual culture of urgency, the nature of how the funding and project and the nature of emergencies, how that all contributes to creating workload challenges and managing workload challenges, the uneven capabilities of managers for reasons Mike just discussed. So there's a complex interplay of challenges obvious with most INGOs. But I think we're doing an assessment like this and naming the particular challenges and how they're working at play within your organization allows you to see them and see how some of those common challenges like perpetual urgency and work overload have become normalized, and then make choices about do we want this to continue? Where is our agency here? Where are our choices? What can we do to change this culture? And that's not going to happen overnight. It's not even going to happen in 6 months. But these reports create some space for trajectory shifts that can unfold over years after the assessment, with dedicated effort and with staff internally who are willing to champion and carry forward these sort of recommendations that we're going to talk about soon. So yeah, it just helps organizations make choices and set priorities in relation to their particular constellation of challenge factors that are at play. Yeah.
And I just want to, if I can echo that and reinforce that, like what Lisa said, like these sorts of challenges are quite common across the industry, and I would say even quite common not only within the humanitarian industry, but within the corporate spaces with which I interact as well. These sorts of tensions can be quite common. Yes, so we can normalize that, and as a coach, I want to honor people's autonomy and ability to make choices. And what Lisa's starting to say is like there are choices that leaders can make in these situations. And I think, sometimes leaders just get so used to a certain mindset, like we must grow, we must grow, we must grow, and growth is good, and we must pursue grants and all that. And that's understandable. And, that can help achieve the organizational mission. And I think part of what this assessment enabled discussion is like, well, when you make decisions to pursue growth, you are implicitly making decisions that impact staff well-being. So let's just put that out there for decision makers about what decision do you want to make? What's going to be most effective for your organizational effectiveness, achieving your objectives over time? And let's, and I think part of what we were able to do is help the executive team, help the leaders see that there are choices to be made in this.
Yeah, that's great. So I want to talk more about these choices and priorities. So Lisa, what did you recommend in this, case study that we're talking about today?
So we made a lot of recommendations. We're just going to talk briefly about 3 of them now. And I will start with one of those recommendations, which was we recommended that they implement a comprehensive and systematic approach to addressing these issues, that they take the data, that they take this very comprehensive, very long report that we had created, that was divided into all sorts of clear sections and ended with some very clear recommendations about steps forward, and that they create a wellbeing task force internally. Like we've alluded to, this organization clearly did care about staff wellbeing. And they did want to see genuine change, and that they create an internal wellbeing task force to oversee efforts made during the next several years. And the idea behind the task force was that they could assist the organization to examine and implement the recommendations made in the report. There were a lot of them, and we gave guidance for how to tackle them. But like I said, there was more in that report than could possibly be implemented in 6 months, even if they had wanted to implement all the recommendations all at once. They couldn't have that. That's not how, this all works. And so their task force can help create policy, different mission statements, duty of care statements to guide forward motion, finalize the process to help country officers review staff wellbeing annually. Very simple process. Not looking to add extra complexity. Like, we're talking simple checks and balances and communication channels. So that was one.
Sure. Yeah, and I mean, some of that, even as we were working with the working group and coming up with some of these recommendations, they were different levels as well. And we wanted, they wanted us to have recommendations that could be actionable at country office level, at all sorts of different levels. And so we strived to make this as actionable, as tangible, as simple as possible. And as we were developing the overall framework and going with reviews with the working group, some of the working group members said, this is awesome. And they just started using it with their staff. And they started actioning some of the things even before it was approved by the executive leadership team, because it was so actionable and so easy for them to do in their weekly tasks. And so we thought that was a real positive thing, right? Yeah, look, another area that we had a lot of recommendations was around the executive leadership team and around leaders making specific choices and deliberate actions to address their patterns of overwork, their patterns of urgency, their mindset of everything is growth, everything is urgent. Just realizing that some of the choices that they had and some of the costs, some of the, maybe making explicit some of those implicit costs. And look, I mean, I served as a country director in an international NGO. I understand the challenges, the types of challenges and pressures that executive leaders face in these roles, right? And I interviewed a number of executive leaders, both at country level and at headquarters level, and as part of this process. And I could understand when they were talking to me about some of the tensions they were facing. Like, I personally understand that. I've been in very, very similar shoes to what they're facing. And I could say to them, well, okay, what choice are you making in this? What are you choosing to value in this? And how are you choosing to honor your own well-being and resilience? And what are you doing to honor the well-being and resilience of others around you? Like, those are the sorts of choices that all leaders get to make if they want to. And so that was a big area of this. Like, what are things that the executive leadership team can do to really model that they want to walk the talk on some of these things, and seek to shift some of those aspects of the organizational culture that were impeding that we judged were impeding the desire of the organization to promote staff well-being.
Yeah. And to challenge that subterranean narrative that all growth is good, which I think many organizations and many leaders internalize, and to bring that out into the light and say, okay, like as Mike was saying, let's talk about this, and let's say, here are the benefits and some of the hidden pitfalls to growth and to rapid growth and to taking on new projects in areas where you don't yet have staff, and to outstripping current capacity in this particular way. And let's talk about that. Let's surface some of the hidden costs of that.
Let's bring more explicit, when these choices are made to grow in a new area or whatever, like there are organizational costs, like somehow that has to be supported. And so just making that a little bit more explicit in the decision-making process. And I've worked for lots of organizations that don't make that more explicit. And I think that leads to all sorts of repercussions and reverberations throughout the system as well.
Yeah. And talking about systemic things that organizations can do to support and create space for well-being initiatives over time. So things like writing specific activities into grant proposals moving forward. So when you do grow, building in right from the beginning, when you're talking with funders about what are we going to do to support our staff? These are some of the costs that are going to come associated with this project on staff. What are we going to do to support staff? And here's why that's important, both for the staff and for the work, and the outcomes that we're all striving to see. So a third finding, and then I think we'll stop and see and take some questions, but a third set of recommendations that we made was related to increasing support for issues related to vicarious trauma and stress for the staff. So given the heightened level of trauma that staff were exposed to with this organization because of the nature of their work, We recommended that they increase their counselling session limit that they had with their employee resilience program with KonTerra, and that they continue to increase access to group supervision sessions, which were happening with many of which were happening with local providers in different cases, and that they were already doing. Many offices were already doing this, not all, but the in-depth data analysis also not just allows us to look at what's going, what's hard and what's going wrong, or where the tensions and pressures are, but what are offices already doing that's amazing. And we found a lot of that with this organization. So one of the things was a number of different offices already had a good system in place for group supervision for their frontline staff who were working to support refugees and with mental health training and things like that. And they were already working to support them sort of piecemeal. So we said, this is a great initiative that's already happening. Let's strengthen it. And let's look for ways to solidify, build it, support it systematically. And consider whether and how to build additional connections with mental health providers who are based locally in country office locations, again, which was something that was already happening organically. We also did recommend specifically providing additional training related to vicarious trauma, which is something that I think the industry is becoming much more aware of in general, but still for many staff at different levels don't have a clear understanding of what vicarious trauma is and how it can impact you when you're working in roles like this. And as I referenced before, to write in activities supporting staff wellbeing in every grant proposal moving forward. That's one it's one achievable structural change that can create space and provide funding and normalize the discussion around staff wellbeing as as an important topic, and normalize attending to it as a priority at organizational level. So I think I'll stop there. We could talk for a long time about this, but yeah.
That's great.
Let's open for questions.
Yeah, we have had some questions come in. So one of the first ones was kind of back to earlier in the conversation about the data collection. So the question is, how did you set up the collection of data so that it would be sensitive to anonymity to preserve a genuine response?
That's a great question. So when we crafted the communication around the data collection, so we're talking about the survey, the interviews, and the focus groups at the moment, we made it very clear in writing, and this was in communications that came from within the organization too, and also from us at the start of, let's just talk about the interviews. We wrote it into the communication from the organization when they were alerted, when specific people were alerted that they would be invited to give an interview, and they could say yes or no. But we had them alerted internally so that the person that we would email and say, hey, we would love to connect for an hour for a confidential conversation, knew that this was happening within the framework of the larger organization, and that they had been told internally that the interview would be confidential. We repeated that in writing in our approach, and also it was reiterated at the beginning of every interview that what was said was confidential. The notes would be confidential, that the data would be obviously analyzed and shared in aggregate, but that nothing identifying would be shared. And we even went to the level of, we included quotes from the interview and the focus groups in the report. They were always anonymized, and if we had any concerns that the individual quote that we wanted to share for a particular section might be identifying, we actually went back to the person involved in a couple of cases and said, we would like to share this quote, not with your name attached, but even anonymously, are you okay with this particular quote being shared in this way? So that was how we did it with the interview. We also had very clear disclaimers with the survey and said, we didn't ask staff. I don't think they were not asked for their name when they've completed the survey. A bunch of identifying sort of information around age and gender and location and whether or not they were a manager, but not their name. So that's a short answer. Not a short answer, a medium answer.
Great, thank you, Lisa. Another question that came in, it says, other than languages, do you take cultural differences and nuances into consideration when you're working with such a diverse group like this? Did the staff needs vary between countries or regions?
Mike, do you want to tackle this one first?
Sure. Yeah. I mean, the answer is yes, yes. And what we saw, Lisa was talking about how at country office level, some teams were already undertaking different initiatives within their space to try to address some of these things. And one of the things that the leadership team told us at the beginning, and the working group told us at the beginning, is they really wanted this assessment to be able to provide tools and framework that could be useful at country level. They didn't want an academic paper that would sit on a shelf and collect dust. They really wanted it to be usable at country level. So we always had our ears out towards how could this be more applicable at the as close to the ground as possible, right? And so some countries are already doing some things, right? We would always be trying to provide broad ideas, but then say it's up to the country to tailor this in a way that works for them. So an example of that might be the organization putting more value and putting some funding to enable this sort of thing, or suggesting this sort of thing is a good thing to do, like a supervision from a local counselor who can do peer supervision for vicarious trauma. Like that is a good practice, but we can't prescribe that as to exactly how that should happen. We could identify maybe ways in which the organization could support that, but then enable that to be tailored to context level at country level.
Yeah. And part of our recommendations around communication processes that we recommended were to enable these sorts of country office level ideas to be to filter up and hopefully be actionable. So different offices and different cultures are going to have different ways. In one office, for example, one way to support staff well-being might be to provide cooked lunch for the staff, which in the context that they're working and living in means that those staff where food and the ability to prepare food and other community pressures might make assembling healthy lunch very, very difficult. And so in certain contexts, you'd be like, what, a fully cooked lunch for all staff? That wouldn't work here. But in other offices, you're like, wow, if we can feed our staff who are working in the camps one hot, nutritious cooked meal a day, that's a huge bonus in terms of well-being, in terms of freeing up their time and energy and making sure that they're receiving certain nutritional things. So those are the sorts of ideas that often come from within, but then systemically you want there to be space for those sorts of context-specific ideas to be supported and to take root.
Great, thank you. I've got a couple more questions. So earlier you mentioned the uneven capabilities of managers as something that can undermine staff well-being. Can you say a bit more about that and what you recommend in terms of managers?
Sure. I mean, well, look, there's so many things that can be said about managers. I mean, one thing to say is this sort of dynamic is not uncommon within the industry, and like especially when you have lots of fast growth, oftentimes people who are star individual contributors, people who are doing well in their individual contributor role, are then promoted to become a manager. And what they can often find, and I've seen this in my working in this industry and field positions, is the skills to be an individual contributor are not exactly the same as the skills to be a good manager. So there's quite a bit of organizational upskilling that needs to happen, and sometimes just doesn't happen as well as maybe people envisage that it should, right? So that's one component. Another component can be, frankly, like if you have 4 team members who are all working at the same level, and then one of them gets promoted, then all of a sudden you're managing some of your friends, and that is a tricky dynamic. And that dynamic, so I should say these two dynamics, the whole like a good individual contributor does not automatically create a good leader. Like that's not only limited to international development sector. As a coach, I come across that all the time with Fortune 500 companies. So some of these dynamics, like you can see there's a lot of need for trying to help with the very human dimensions of being a good manager. Now, you can say, well, what does that entail? And KonTerra strongly recommends managing for well-being. So equipping managers with skills that will enable them to better manage themselves for their own well-being, and also support the well-being of people below them, support the well-being of people that they're managing and leading. And that can be things like having more awareness of the big risk factors, having more awareness of vicarious trauma, for example, right? And also like how to have better communication with your direct reports, and having regular meetings with your direct reports where you're discussing workloads and prioritizing workloads, conflict management, and performance management. This can be a huge challenge across the board, where especially if you have a dynamic where you used to be the same level, and now all of a sudden you're managing you're managing your friends. Like, doing performance management and corrective action in those situations can be tricky, and so it requires support and some new skills and growth, right? So that's one big area of managing for well-being. Another area is oftentimes managers are caught, or managers feel that they're caught in between demands from above and demands from below, right? So I think a big part of managing for well-being is helping managers at whatever level they are to be able to manage up and bring things to their manager and say, hey, these are some of the tensions that we're facing, and this is how it's impeding upon our ability to achieve our goals. I'm speaking very high levels, right? They can say, this is how it's making it harder for us to do our jobs, right? And so how do they seek help from people above them and people diagonally above them to help them live the organizational values and mission and manage their own well-being? Those are big skills, and so those are areas that we think can make a big difference, not only for employee well-being, but also for organizational effectiveness.
Yeah.
That's great. Thank you. So one last question came in. It says, including in project funding is an interesting idea. Have you seen project funding used for staff support in this way before?
Yes, is the short answer. And I think many organizations, Mike, I'll ask you to speak on this too, because you've lived this as a leader yourself in the field. But I think there's sometimes a lot of anxiety. There's so much focus on justifying every cost and accountability and financial, good stewardship. And that comes from good, sensible places. But I think sometimes that translates to we can't budget in anything that's not absolutely essential, and often staff well-being activities have not been considered essential, and I think that is changing. And I think that sometimes we can have anxiety about writing in these items into grants and having dialogues with funders, but in my experience, actually funders are very receptive, that the culture around this is changing, and that when you go to funders and you hold up staff well-being as a value alongside project outcomes, that there often is space to have that conversation and to have that accepted and acknowledged by funders as a priority. Mike, do you want to say about when you've seen this?
Yeah, sure. I mean, I can put on my hat of being a country director and implementer from 5 years ago, but we had experience where our staff were doing domestic violence programming, and we made an argument, a logical argument to our funders, saying, in order for the staff to be able to support others in making a transformation, a transition in changes in behavior around what was acceptable with violence, we also need to focus on our staff. And like, we actually need to start the work with our staff, because if you didn't have changes of behavior and protection for your own staff, like, how could you expect them to be able to engage in this really challenging subject matter in communities? And like, it was a very logical argument, and our funders got behind it immediately. So look, that's only one data point, but I do think oftentimes our mindsets can become some of the barriers. And if we realize, like, oh, actually, staff well-being, training our staff to be able to succeed in these things actually can lead to more organizational effectiveness. It can actually lead to more efficiency in donor funding. It can lead to all these things that we say we want, and we just need to be intentional and explicit about that.
Yeah, and tying the discussion to values can really help here. So both the organization's values and the funders' values. So what are the funders' stated values? And they care about service, clearly, and helping the vulnerable and helping the at-risk and supporting well-being and increasing quality of life, and all of that often applies to the staff in the aid programs and the staff that are providing the service in similar, not identical ways, but in similar ways to the community members that the staff are seeking to work with, or the refugees. So I think remembering to think about the role that values can provide as an anchor and a resource when you are, advocating for that funding in proposals.
That's great. Thank you both so much. That is the end of our questions. So I was thinking we could shift to kind of closing statements. I just wanted to thank you both so much for your time. This has been such a helpful and valuable discussion, and also thank everyone who came out to join us today. And I'll, pass it over to you, Lisa and Mike, if you have any closing statements or thoughts.
Thank you for being here. Everybody has busy schedules, full schedules, and thank you for taking the time to think through these issues, alongside us as we talked about them. We hope it's been helpful. And if you have further questions about the staff care process or opportunities for your organization or a different organization, don't hesitate to reach out and explore those questions with us.
Sure. All that.
Great. All right. Thank you so much, everyone. Have a great rest of your day.
Thank you so much, Kate.
Thank you.
Bye all.
Bye.
Bye, everyone.